Welcome.
Good afternoon. Hope you had a nice lunch. Mhm.
Please, no questions.
We are going to get started because we have a jam-packed meeting today. So the first thing we're going to do is if there's anybody new who is not a presenter, anybody new that is not a presenter, can you come unmute yourself and introduce yourself? Tell us the organization, the role you're in your organization, as well as why are you here at the meeting? All right. Anybody? I see a new person. I'm gonna call names.
This is Jeff.
Oh, Jeff, tell us who you are and what brings you to the meeting.
Okay, I'm Jeff, and what brings me to the meeting is I'm part of Westside Overdose Prevention Center, and uh, I just want to gain some information the uh, about what's going on.
All right, Jeff, welcome. Anybody else new to the meeting?
Hi.
Hi.
Good afternoon, everyone. My name is Greg Cox. I am the Fatherhood Coalition Coordinator for Bright Point, and I am here. I've actually been receiving email. I'm just having an opportunity to come to the meeting, right? I am here because I just believe that father absence and father engagement is connected to the opiate issues and issues that we're having in our community. Thanks.
All right. Welcome, Greg. Thank you. Who else is here?
Good afternoon, everybody. Oh,
I see V and Bello, I think.
Bucola. Yes, that's me. I'll go ahead then. Bucola Bello, thank you so much. Good afternoon, everyone. My name is Bucola Bello, contract lobbyist with BCN Strategies on behalf of Indivior. This is my first meeting, so thank you for welcoming me. Representative Ford provided me with this information, and so I do hope to be an active participant and to listen in and weigh in. And I thank everyone. My role is just to take notes and then at the proper time and place to provide feedback or connect you all with the proper people that can provide feedback. So thank you. Thank you for the introduction.
Wonderful. Welcome to the meeting.
okay. Now this is V. Lewis, everyone. I'm 3 days old at Loretto Hospital. I'm here in the crisis department. I'm here on behalf of my director, Mark Harris. And I am looking forward to find out how our facility can assist with this task force.
Oh, welcome to the meeting. Welcome to Loretto Hospital. Yes.
Thank you.
Right. Who else is new to the meeting?
Hi, I'm Chris Grella. I'm here with my colleague, Mike Dennis from the Lighthouse Institute, which is part of Chestnut Health Systems. And we're hoping to have a few minutes to talk to you about a study that we're proposing where we hope that we will find some of you will find it of interest and hopefully participate with us as partners.
Welcome. Welcome.
Thank
All
you.
right. Anybody else new to the meeting?
Hi, my name is Dr. Diane McKenzie. I'm a psychiatric mental health nurse practitioner. I was invited by Dr. Sorrell and to talk about a policy change we're hoping to do using ear acupuncture in the state of Illinois.
All right. Very good. Anybody else new to the meeting?
This is Mike Dennis, the director of Chestnut, Lighthouse Institute at Chestnut, the other half of Chris Grella's introduction.
All right. Very good. We're going to hear from you guys later today. Anybody else new to the meeting?
Hi, Fania. This is Sophia from Haas. I'm representing Haas and the harm reduction department here, standing in for Tom Nichols.
All right. Welcome, Sophia, to the meeting. And aren't you the new drug checker lady too?
Yes, I am the new drug checking technician, but I'm sure I will have more information for you all in the new year about that.
All right. Thank you. It is now 1:05 and we have a lot on our agenda. So I'm going to get started with Liv. We know we usually have our West Side coordination meeting on December the 27th. We know that it's the holidays, nobody's going to be around. So we decided to have the West Side coordination meeting brought to this meeting. So Liv is going to do the presentation on the data for the West Side, what's happening with overdoses. So Liv, take it away.
Hi, it's actually Maria today. Liv is having some technical difficulties. I am here though to help. So I am going to get started sharing the data, and if Liv has a chance, if her technology starts working, she can jump on and share, but I will go ahead and start.
Wonderful, Maria.
Yep, it looks like I can share my screen. Okay. And I'm going to present. Slideshow. Okay, can everyone see my screen okay?
Yes.
Okay, great. So this is just a little bit of an overview of kind of what's going on in the city currently. So some updates. CDPH substance use coordinations meetings will begin again in January 2025. And if you are interested in joining these meetings, you can sign up by sending Liv an email, and her email is linked. And this deck will also go out. So don't worry if you don't get a chance to write it down right away. We'll no longer be forwarding the email invites just because it gets quite overwhelming for Liv to manage all of this data and all of the emails. So just that they will be coming. If you email her, you can get added. So we are currently still holding volunteer kit builds. So right now we're looking at tentatively January 23rd at 1920 Southwestern for our next kit build. And you can scan this QR code or email osu@cdph.org if you would like to join us in kit building, or if you would like to host your own kit build where we build the supplies that go into our vending machines or just other supplies that are going out to the community. So if you're interested in building that with us, we would love to have you, and you can fill out the form here. There's also free trauma-informed trainings that are offered through the Office of Violence Prevention and other partner organizations. So it's kind of like a trauma-informed learning cohorts for community-based organizations. They offer some certificates, some CEUs, and other kind of incentives. And they're also free public-facing workshops, which are single-day workshops that are open to all of Chicagoans. Kind of topics around like Trauma 101, restorative justice, things along that. And you can either, again, scan this QR code here, or visit chicago.gov/heal if you're interested in any of these free trauma-informed trainings. So we also have a job posting update from EDC, the Educational Development Center, looking for community ambassadors for the state settlement opioid evaluation project. They're looking for folks with lived experience, positions in casual opioid abatement strategies, effectiveness evaluation, community ambassador. So more information about this job can be found at the link here. And feel free to circulate this among all of your networks and have any potential applicants, they can email EDC at the email listed. So great opportunity for individuals in the community. Okay, so kind of starting to transition to some of our data. As many of you know, or hopefully know, we have 5 public health vending machines that are operated by CDPH in areas of high overdose in the city of Chicago. So you can kind of see in the map here, they're kind of strategically located in different areas of the city with, again, high overdose numbers. And all of these products that we come out of the machine, things like Narcan, fentanyl test strips, like general hygiene kits, things like that, they're all free. So all you need to access is a PIN code. And as of November of this year, November 30th, we have distributed over 3,100 PIN codes to the community in Chicago, which is really exciting. So some data behind these vending machines. As of November 30th, almost 15,000 products have been distributed from all of these machines, which is just really incredible. And thankful for this organization and all of these people who help us put these out and help us make kits and things like that. So just a little bit of data behind our machines. We're able to get some voluntary questions answered through a survey. And so we can kind of see that about 15% of people who are using these vending machines and answering these questions have reported experiencing an overdose in their lifetime. And that of these people who are reporting these information, 41% have witnessed someone experiencing an overdose, which is kind of going to show that these vending machines are reaching people who, there's potentially experiencing overdoses or witnessing in their community. And so it's great to have the, Narcan on the streets and things like that. In terms of housing, about 40% of people reported being unhoused, living with someone else, or living in a shelter. And we have, in terms of things that have come out of our machines, the most has been socks and underwear kits that have come out. About 5,000 kits of socks and underwear have been given out to our community members, which is just really exciting. And if you're interested in learning more about these vending machines or more data interested, you can visit the most recent brief. We make a monthly brief of the data, and it's again linked here, which will be going out, and so you can access that. We also have the Find Narcan Near You map, where it is available through this scan or Find Narcan Near You, and you can find Narcan in the closest area by putting in your address or zip code and finding the closest Narcan near you. And we've got about 6,000 views on that as well, which is really great to see people using it and utilizing it and finding Narcan near them. So that's just a great thing to plug and send out to people. So now we're going to transition a little bit into mapping and data. So currently this is looking at opioid-related fatalities citywide in the city of Chicago from 2015 to 2023. And currently in 2023, we're still seeing about 1,333 fatalities of 2023. This number is provisional and expected to change a little bit per case finalization, but relatively stable compared to last year and the prior year in 2021 with a peak we had 1,441. But hopefully remaining relatively stable, optimistically stable, hopefully, in terms of fatalities. So looking at opioid-related EMS responses citywide, you've got the 2022 in this dark blue, 2023 in this lighter blue, and 2024 in this red color. So as you can see, for 2024, every single month has been less than the prior 2 years worth of numbers compared to for each month. So in November, we saw 507 opioid-related EMS responses citywide compared to 927 in 2022 and 699 in 2023. So hopefully we can be able to identify like a drop in these cases in EMS responses citywide. So now this is looking specifically at the opioid-related EMS responses specific to the West Side. And when we say the West Side, we include Austin, East Garfield Park, West Garfield Park, Humboldt Park, and North Lawndale. And so kind of similarly to the citywide, most of the months of 2024 in the red saw a decrease in opioid-related EMS responses compared to 2022 and 2023, except for the month of July. Every other month saw decreases except for July, but in November, there was 184 EMS responses compared to the prior 2023 of 230 and 2022 of 330. So that is good news. And then again, this is looking at EMS responses on the West Side specifically for the month of November compared to 2023 and 2024. So in these 5 community areas, you can see that most of them, except for Humboldt Park, saw a decrease compared to 2023, where Austin had a pretty substantial decrease compared to 2023 to 2024, with going from about 70 in 23 to 41 in 2024. Hopefully continuing to see a little bit of a decrease and continuation on the West Side. So now we're gonna get a little bit into mapping, and I've got Liv here back, so she's gonna take over.
Hi, everyone, and thank you for your patience today while we sort out our technical difficulties here. As usual, CDPH brings the excitement. Jumping right into some mapping for you all. I know this is a little bit different than what we would normally look at when I hand out hyperlocal heat maps. I pulled this from our OD map, our overdose detection program, which allows us to get a little bit closer to real-time data than what we would normally look at when I pull hotspots together for everyone. So I wanted to give you something a little bit more recent, because I haven't been able to meet with all of you and talk about this in a while. So because of the way that OD map is set up, I can't pull just community areas. it's easier to pull by zip codes. So I pulled some zip codes together, or I pulled data by zip codes, kind of based on the community areas that we think of as the West Side, which Maria had spoken to a couple slides ago. So first zip code that we're going to look at here is 60651. It covers the northern part of Austin and Humboldt Park. And the hot area for this that I wanted to flag for all of you is the area of Pulaski to Hamlin from north to Chicago. So a little bit of an area, geographically bounded by those streets, but that's kind of what we're seeing. Again, this data is from December 1st to December 16th. So, stuff from just the past couple of weeks. Next zip code is 60644. This area, 60644, covers the southern part of Austin. Hot areas that I wanted to flag for you is the Madison corridor from Austin to Cicero, and then the central corridor from Chicago to Madison. You can kind of see these in the orange here in the map to the right. The next one is 60624. This covers a few different, it intersects a few different of our community areas that we think about. So Humboldt Park, West Garfield Park, and then the western part of East Garfield Park. The areas that are kind of hot for the past couple of weeks is the area near Madison and Costner, near Madison and Pulaski, and then the Chicago Ave corridor from Springfield to Central Park. So we're seeing generally in this data, I feel like we're kind of seeing the Madison Street corridor pop up in a few of these. For zip code 60612, this covers the eastern part of East Garfield Park and the western part of the near west side, so a little closer towards the loop. Hot areas are the Madison corridor again from Kedzie to Francisco, and then the Kedzie corridor from Madison to 290. So again, seeing Madison kind of popping up as a hotspot area. For zip code 60623, this is most of North Lawndale and South Lawndale. So pretty big zip code. Our hot areas are the Roosevelt corridor from Pulaski to Kedzie, specifically thinking about Roosevelt and Pulaski, which you can kind of see in this map is like a little bit of a darker orange. And then the area of 16th Street to Ogden from Harding to Ridgeway. So kind of like northeast of that Six Corners intersection, which for those of you who have been on the CDPH coordination meetings, we kind of talk about this spot regularly, not every month, but kind of like every few months it'll pop up. So that is one of our hot spots again for the beginning of December. I apologize. I know that we usually give everyone, I usually give everyone like time information, like hot times of the day or like ideas on location type, but because of the way that I was able to pull the data today, there's a trade-off. Like if it's a little bit more recent, I don't necessarily have all of the associated information with it. So providing as much as I can. So I apologize, we're missing some things. These slides will be coming out to you all. So I wanted to include some information on who you can reach out to for different things. If you're interested in our general substance use programming or getting Narcan or test strips, so fentanyl, xylazine, or nitazine test strips, you can reach out to osu.cdph@cityofchicago.org. If you're interested in just general health-related data, including the opioid data we covered today, but a little bit older because it's like finalized data, you can visit the Chicago Health Atlas, and I've included the link there for that. If you are interested in being added to the coordination meeting, I think Maria already spoke to this, but you can email me directly, and that's my email there. And then if you have any questions about today's presentation or data that we've discussed, or if you just want to say hi, you can feel free to reach out to us. I've included our emails. I'm sure that many of you know that I have a little bit of a delay when I get back to people, but I will always get back to you. It just might take me a minute. And that is the end of our slides today. I'm going to actually hand it back to Maria. Thank you all.
Thank you, Liv. Thank you, Maria. Do you have any questions for Maria or Liv? Anybody? Raise your hand. I'll call on you. I did have a question. Why was there a bump for Humboldt Park? Was there any explanation for that? An increase?
We actually don't know. So, I mean, we can look into it a little bit more and see if we can identify, like, if there was one area in Humboldt Park that had a high concentration of cases, like on a certain day or something. But other than that, we haven't really looked too much into the huge increase and decrease. Yeah.
Another question that we have been wondering about at here in the headquarters, right, is about, we've heard that there has been an increase in Black and Indigenous communities regarding overdoses. However, there's no data that talks about the work that we're doing here in Chicago. And so we've been wondering if we are following the national trends because of the work we're doing, seeing a reduction in overdoses in Black community here in Chicago. And I don't know if you have anything that can speak to that, or is that something that we should maybe have a special meeting on to see if our strategies are working to decrease overdoses on the West Side.
Especially overdose deaths.
Yes.
We're seeing that EMS calls are going down.
Mm-hmm.
Yeah, I think that's something really interesting that we should probably look into. In terms of, yeah, like Lee said, in fatalities as well. It'll be interesting to see once we get the fatality finalized, if there was a real, because reduction in EMS responses doesn't necessarily translate to number of reduced deaths.
Mm-hmm.
So that should be something interesting that once that data is finalized, we can look into.
Thank you, because that way we can measure impact of our strategies. And if our strategies are working, then it's a national miracle and we need to promote it, right?
Exactly.
Amen, church?
So exactly. We're hoping to do like a full analysis. We recently are hiring an EP4.
Mm-hmm.
And so hopefully when that EP4 starts, we can do like a big analysis into this. So that's something we're definitely looking into.
All right, thank you. And then Luke has a question.
Yes, in last report for the last quarter, you used to map and put the strategies and organizations that were out in those strategic spots in the community. Why is it we no longer have that information?
Lou, I'm so sorry. Maria handed me the microphone. Can you repeat your question, please?
Yes, in the past, up until I believe the end of August, we would get information as to what organizations were at some of the strategic spots out in the community where the overdoses were occurring. And we no longer get that information. Why is that?
You're talking about when I would like map the like add your outreach organizations into the maps. Is that like, okay, yeah. The only reason that, well, first of all, I've been not the best at sending out maps to you all recently with the November and the December meetings canceled. So I haven't been, like when I pull the maps that I put together for you all today, they're from like a different platform. So I can't add outreach organizations to those. So that's part of it. And then the other thing is just, I've been really, really crunched for time with getting everyone's stuff, like all of the outreach stuff geocoded. So I've just been really behind, and that is basically the issue. So I apologize, but I promise you that I will add that back in when we start the meetings back up again, because I know that you all rely on that.
Yes, because we have about 20 some team members, and they be looking to see were we right on target or did we miss the spot? It was very helpful to us. And I guess it was pretty exciting too, because we were kind of on point a lot. Thank you.
Yeah, I always loved seeing when I would do the maps and put the outreach stuff in there, seeing how the hotspots kind of moved around based on the work that you all were doing. So I enjoy looking at it. What I would love to do is like a full, kind of what Maria mentioned, like we're thinking about how to do like a deeper dive into all the data, like the Narcan that's being administered or distributed, the outreach work that's happening, where we're seeing EMS responses, where we're seeing fatalities, things like that. Kind of, we're trying to start thinking about like, how can we do like a big analysis on all of this? But yeah, I will make sure to add that back in for you all.
Great. I see James has his hand raised.
Hello, thank you. I have a question. Do you track, or do you have the ability to track fentanyl concentration in the drugs that are being distributed? Because one of the theories I've read recently, not only nationally, is that fentanyl is just not as available. And so the drugs that people are buying are less potent. And that's one of the reasons for, not to take away from people's efforts, but that they're just not getting, the drugs just aren't as strong. So they're not overdosing as much and not dying as much. And that's why we're seeing stats. Have you been tracking that or heard about
Yeah.
that?
Yeah, so we're aware of that. And that's kind of something that we usually, when we're talking about like seeing this decline and like following the national trend, that is something that we're kind of thinking about is like, okay, so maybe there is some differences in the fentanyl concentration, right? And this is also kind of seen in some of the new adulterants that we're seeing that have entered into the drug supply in Chicago, like medetomidine, for example, right? So we are aware of it. One of the things that we have going on, so we work really closely with Chicago Recovery Alliance, who is obviously like setting the standard in Chicago and probably nationally for drug checking. We work with them to get some of their drug checking results so we can look at that. We also are standing up, we're in the like beginning phases of standing up a drug checking cohort. We put out an RFP, I want to say like about a year ago, and we have a total of 5 organizations who are going to be drug checking and giving us like their analysis. So we are going to be able to say like, okay, this is kind of what we're seeing in the drug supply. So it is on our radar, but that's a great flag.
Thank you.
Mm-hmm.
That was a great question, James, because that will figure into the analysis of the strategies we're using. So that's the end of our Q&A portion. Did I freeze?
There you go.
Freeze. I can see I was frozen. That is the end of our Q&A for Liv and for Maria. If you have any need for data mapping, those are the individuals to go to. They know their stuff, and I appreciate this. So thank you. So next we're going to go to Patrick.
Thank you.
You're welcome. Yes, we're going to go to Patrick. Patrick is with Collaborative Bridges, and they're opening up a new wellness center on a very hot corner, and we are so excited about this on Pulaski and Lake, and he's going to talk about Collaborative Bridges and what they're trying to do. All right, Patrick, take it away.
Absolutely. Well, thank you, Fania, for the invite. I'm going to pull up a few slides really quick. I'm also going to drop our referral in the chat, or our referral flyer. But yeah, this is great, convening. I would love to be part of these meetings ongoing. I've also invited my clinical director, Ray Nett, to join us. So I am Patrick Dombrowski. I am the executive director of Collaborative Bridges. Prior to stepping into this role, I was the chief clinical officer at Counseling Centers in Chicago for several years. So Collaborative Bridges is one of the healthcare transformation projects that was funded by the state of Illinois. All of this kind of came out of, after George Floyd's, death. The Black Caucus funded several projects to really, transform, if you will, healthcare services within, west side of Chicago, south side of Chicago, East St. Louis. So we are comprised of Humboldt Park Health, Loretto Hospital, Park Grove Hospital, and then the community organizations, the PCC Community Wellness, TASC, Community Counseling Centers of Chicago, Bobby Wright, and Habilitative Systems. I know I don't have a lot of time, so I won't spend a lot of time, but we're fundamentally born from the health disparities that you all know exist on the west side, and the pretty staggering just lifespan disparities there. Our project really is focused around behavioral health, and our clinical model is really fundamentally designed to work very much like a community support team, but with a brief focus. So we have teams in all of the hospitals. They have Collaborative Bridges staff that work for the hospital, and then we have teams that really just ensure smooth transitions and immediate service delivery upon discharge. To date, we've seen about 2,000 people Our real primary focus is to ensure that individuals discharging from inpatient psych don't return. And our rate of return is around 9%, which is pretty significantly less than the average. So, when they discharge, we have a transition team that kind of makes sure that immediate needs are addressed, and then they get handed off to a team that comprises of master level social workers as well as CADCs, and then community health workers, peers, and care coordinators. So I did include, and I'm happy to send these slides out, just some drivers and our impact, but fundamentally in terms of our vision and model, we are very much designed to have service delivery in the community. When people get out, we're working with a population that historically has 7 or 8 hospital admissions plus in a year, and we have a team that very much is engagement focused. So we spend a lot of our time, similar to that West Side Heroin Opiate Task Force does, of trying to outreach people that currently aren't receiving services. In terms of really kind of our focus at kind of going forward, Vanya mentioned we are opening a wellness center. It's at 4223 West Lake, and it will be a home for our existing community stabilization teams that C4, TAS, Bobby E. Wright, as well as HSI staff, but it'll also include ancillary services. It's very much built with the focus of having full wraparound care. Fighting the zoning fight right now, so we'll probably be a few months off before we have primary care and pharmacy, but that is planned, and we're optimistic that happens late spring at the latest. But we will have ACT services there, CST services, substance abuse treatment. In terms of immediate services starting in January, Bobby E. Wright will be opening their drop-in program, which I think has significance, obviously, in terms of the work that the West Side Heroin and Opiate Task Force does, since they are often right at Lake and Pulaski. And then similarly, C4 in coordination with Cook County is opening a triage program. So we'll have both kind of the harder drop-in that's recovery focused and the softer more living room style program that C4 is going to operate. We also work very close with all of the MCOs, have active partnerships with Molina and Aetna, planning, and we'll probably begin in the new year with Blue Cross Blue Shield, Conicare, and Meridian. And then, the last piece in terms of kind of 2025 is we are adding 3 new teams, and we'll have 3 hospitals. We're really deciding whether we want to scale in other areas or bring on additional West Side hospitals in 2025. The biggest thing, and what I think that all of these projects really offer, is the flexibility to be adaptable, and certainly not being tied to fee-for-service, traditional Medicaid models. We are able to have teams that spend a lot of their time doing engagement. We are able to invest in resources for our clients. We have partnerships with both Mercy Housing and the Safe Haven Foundation to ensure that we don't have to send discharges to 10 South Kedzie or Pacific Garden Mission, that we can either get them housed or get them in a transitional housing shelter program. Similarly, we are looking to bring on food security services. I rushed through that because I really do want to talk about our wellness center, and really, how we can foster and build relationships with all of you and the West Side community. The way that our wellness center is really going to be operating, we have some dedicated programs and obviously a place for our community staff to work from, but we also have rooms and other areas that really are for community meetings, when there is need to, have social determinants of health resources. It really is supposed to be a wellness center that does serve West Garfield Park and the greater, West Side community. So, as we really continue to grow and expand, bring on additional partners, start to kind of operate from our wellness center, as well as, really focus how we can have a true integrated hub. I didn't mention that, but, very soon we will have all of our, kind of EHRs and feeding into each other. The goal is that fundamentally our transformation path is for our existing hospitals to be able to really evolve from being triage oriented to being recovery oriented. As related to the work that this group does, for both Loretto and Humboldt Park Hospital, quite a few of the people that we get referrals for are the individuals coming out of detox. And the very same individuals that you guys interact with often are, those that we're trying to engage. So absolutely open to, finding ways that there's synergy, and, happy to be in service. As I said, I just added our flyer to the chat. It does include a number, and that can be used not just for referrals, but if there's a desire to have more information, if you have questions. So that's all I have, Fania. I tried to get through kind of everything and just kind of gave high level.
Patrick, you're doing an excellent job. Does anybody have any questions for Patrick?
I don't know. Ray, do you want to say hello really quick? So people know who you are.
For that, Patrick, my name is Ray Nat Young. I go by Ray. As Patrick stated, I am the clinical director for Collaborative Bridges. I'm always definitely excited about this program. We've been doing a lot of work with the clients in the community and being able to kind of give these resources that is so much necessary and very much so needed. And so I'm always excited about us expanding and having a wellness center and all those great things. So thank you for having me here. I hope to, join more, but thanks for that, Patrick.
Thank you, Ray, for joining the meeting. I had a question because we do see a gap, like upon discharge, really focusing on accompaniment, right? Of like if someone's discharged from detox, honestly, like if we're trying to help them manage their use or figure out strategies on harm reduction, creating a harm reduction plan, and then accompany them to the places where they can get the care or the services they need to help them with their plan. And so I do applaud this this new organization, and like I said, it's one of the hottest corners that you guys are beyond, and to really help the hospitals really understand community engagement and how to just connect people to service upon discharge. I think it's a gap that we're Rich Vargas and I were talking about this morning because we're working with Haas about this. Is how do we get people connected to medicated assistant recovery upon discharge? So thank you for this project. Yes. So Patrick and Ray, put your information in the chat so people can get connected with you. And then also too, there's probably going to be an open house, right?
We will. Yeah, absolutely. Yeah, we're, whether it's at our grand opening event or just kind of ongoing, we're happy to give tours, and show the site to people in person. So don't hesitate to reach out. I did put it again, but I will put it, in here again.
Are there any other questions? I think there was one from Lee in the chat. Did you have one real quickly?
I just was wondering, one of the things we've talked about for quite a while with street outreach is we really appreciate having some trained behavioral health specialists to stop by periodically just to connect with some people, help us maybe separate the use from maybe a pre-existing behavioral health condition. and maybe we find out that they need to be reconnected with their medications or with their supports. So, that street level, the reason it works is a lot of times people don't really access buildings for help. So if there can be built in at least periodic co-location with us when we're out there doing, I'd say in our collaborative outreach group, that would be great. Good for information gathering from your staff and also for maybe even some on-the-spot intervention and support.
Yeah, no, absolutely. And yeah, happy to explore that further. Certainly, I would say 95% of our referrals today have came directly from hospitals, but we do take community referrals. The population we work with is over 18 and, individuals that often have severe mental illness or, acute chronic conditions that lead to chronic hospital admissions.
All right. Patrick, there's some questions in the chat. If you could answer those questions in the chat, that'd be great because we have to move on to our next presentation from Chestnut Health Systems. Thank you. It was awesome. Thank you. From Chestnut. Chestnut has this great proposal that they have been intervention, right? This recovery management checkups, and they're looking for people to participate, looking for organizations to participate in this proposed study. So I'm going to hand this over to Dr. Dennis as well as Christine from Chestnut.
Hi, welcome. So I just want to give you guys a quick brief of what we're doing and show you what we're trying to approach and ask for your help with. We are proposing to do a study to the National Institute on Drug Abuse called the Justice Overdose Innovation Network, actually Justice Community Overdose Innovation Network, or JCOIN. It is a 5-year study trying to link people after they have been arrested. We're recruiting from Cook County pre-bond intake. After they've been arrested and transported there, mostly felonies, some domestic violence and other things, screening for those who have either an opioid stimulant or alcohol use risk of overdose, and then trying to link them to an experiment in which we're going to compare 2 different ways of receiving recovery management checkups. RMC is something that Chris and I have worked on for the last 30 years. We've done 6 experiments and quasi-experiments, all of which consistently show that when you treat addiction as a chronic condition and you stay in the game with people for anywhere from 1 to the longest experiment was 4 years, we can reduce the time from relapse to treatment admission, increase the total amount of treatment and social support that's received, including 12-step. We can reduce their substance use, reduce their symptoms of substance use disorders, increase their rates of longer-term stable recovery. We can reduce risk behaviors, sexual needle use, and others. We can reduce their rates of illegal activities, rearrest, and incarceration. Chris has already put in a link to a presentation that talks about some of this data and goes through the various components. It is a person-centered approach that tries to follow someone over time. We will, if they don't like a particular type of treatment or a particular provider, we switch gears and try something different. At any given time, only about a third of the people we think should go to treatment are willing to go. So we meet them where they're at, and we'll try to get them to agree to some kind of behavior change to protect themselves or overdose prevention. We always provide Narcan, for instance. We will connect them with whatever they're willing to do. We come back, though, every quarter, and we've done this for up to 4 years and shown that we can reduce the time from relapse to readmission by over almost 3 years, about 30 months, over 4 years. So it's a pretty effective intervention. It was part of why ASAM, the American Society of Addiction Medicine, new patient placement criteria now are going to have a new level of care called long-term remission monitoring, the idea of supporting longer-term recovery. Short story, in this version, we've done all these clinical trials using our own staff, and NIDA wants to see if we can get other people to do it. So in this study, we want to randomly assign people 2/3 to a new community provider learning how to do it with technical assistance and financial assistance from us to do it, get them up to speed so that they can do it as well as us, and then also work on the sustainability by using community outreach work or other codes that can reimburse the work that's involved. We're not limited to a Medicaid code. We're just trying to make sure that we're not only thinking about how we can do it and do it well, but also how it can be sustained beyond the grant and providers. I'm going to share my screen real quick. All of this is happening in Chicago. We are proposing it as something that we would do starting at the next fall. If it's funded, you should see on my screen now two maps. Can everybody see the two maps on my screen? On the left is the same CDPH data that Maria was showing us before, but now over 12 months ending at the end of October. End of September. We took 12 months of data to identify citywide hotspots. We looked at it by raw numbers, by rates, and by per square mile. We ended up using per square mile because it actually shows too high concentrations on the far north and downtown that might be missed otherwise. And you can see under the 4 areas that we've targeted in yellow, again by zip codes, just like Maria had, I've labeled for you the number of deaths and the Chicago communities and the primary zip codes associated with them. While these 4 areas only represent about a quarter of the city of Chicago physical space and population, they account for 58% of all alcohol or other drug-related deaths, as well as 71% of all the alcohol and drug-related crime. So obviously the epicenter is the West Side, hence our desire to talk to all of you. But the other 4 areas are North Side, Downtown, and South Side. And we're trying in each of these 4 areas to not only identify people that provide MOUD treatment, either methadone, buprenorphine, or Vivitrol. We also are trying to identify non-MOUD because some of the people we identify through Cook County will have alcohol or stimulants, so the MOUDs are not as relevant. We are also trying to identify in each of these communities 1 or more community-based agencies that's willing to work with us to teach them how to do RMC. It is an evidence-based practice. It has a rigorous training and certification model. And our goal is to conduct a randomized experiment in which we will work with at least 4 agencies, 1 from each community, to show that they can do RMC as well or better than us, and that when they do that, they achieve outcomes, and then work with them to find sustainable funding. We certainly will look at Medicaid, but there are also some MCOs that do some pay for performance that get outside of that. SOAR money can get outside of that. Some of the opioid settlement funds can get outside of that. So we're not wedded only to Medicaid, but it certainly helps if the provider has the capability at least to bill Medicaid or some other fee for service. What I would like to do right now is throw it open to questions. Chris is putting a link that goes through and gives you a 30-minute presentation on this of what we're doing on RMC. This one I've just described to you is really part of the J-Coin Justice program. The one, Dennis Watson, who couldn't be here today, but is sometimes at these meetings, is doing another one in the spring that targets FQHCs and lookalikes and CCBHCs. Those are also doing RMC and also trying to replicate and disseminate and push it out to community-based organizations that are interested in learning how to do that. Chris, I think, is also putting up a longer description that has FAQs like how do you bill for it, who pays for it, all those kinds of things.
Does anybody have any questions for Dr. Dennis? This sounds like an exciting project for one of our organizations who are here on the West Side to get involved with. They're going to help pay for staff. They're going to do deep training of the staff for this particular intervention for recovery management checkups. Questions for Dr. Dennis?
Actually, I want to add just a little bit of detail. So this initiative, the J-Coin initiative, we're currently participating in it, which is, I think there's about 12 or 13 hubs around the country, and each is testing various strategies to reduce opioid overdose risk. This is a second generation of J-Coin, and they've expanded it to opioids and stimulants and other substances, as Mike described. So our criteria is risk for overdose. But very specifically, because I was very interested in what everybody was talking about, and there's so many resources and interventions that are fantastic. This intervention in this study is specifically for people who've had a recent arrest. So as Mike mentioned, we're working with Cook County Jail, and I know there was other discussion about people coming out of hospitals. So we're specifically targeting people with recent arrests. And our intervention, as Mike described in the documents that are in the chat, are the intervention is designed to help people get to treatment and stay in treatment over the long term. So I know many of you are working in settings where there's recovery coaches and case managers. So what we do is somewhat unique in that it's a longitudinal intervention focused strictly on accessing substance use treatment and recovery resources. So if that seems to interface with what you're doing in your program in ways that you would be interested in seeing if this intervention could be incorporated in your program, that's what we're looking for. And we would love to partner with a program or programs that has an interest in working with us on this intervention that would be part of this bigger study.
I
just giving a little bit more
context.
feedback.
I appreciate it. Thank you. We're going to move on. There are questions in the chat, like somebody asked, how far is recent when it comes to arrest? Please reach out, because I mean, we looked at it. I was like, this seems exciting, because I do think accompaniment of people who use drugs is the way we should be working to help them manage their use or if they desire abstinence. So I'm going to move on to our last presenter, who is and thank you once again, Chestnut, Christine, and Dr. Dennis. Appreciate it. Move on to the Illinois Ear Acupuncture, Amy and Dr. Diane. All right.
Hi, how are you? I am Diane. Amy is not here, but just we were invited by Dr. Sorrell to let you know about this. So I'm a part of the Illinois 5NP. NP stands for Needle Protocol of Illinois. And what we're trying to do is to change the law that would allow for ear acupuncture, which is just 5 spots in the ear, that once you take a training class, which is 30 hours of book work, 40 hours of clinical, that you would be able to do this. What is so great about the needle protocol, it also you'll hear about as the NADA protocol, which is the National Acupuncture Detox Association. The history of this, it started in New York, in the Bronx, during the 1970s. And this is also a social justice movement. It was brought by the Black Panthers and the Young Lords, and what they wanted during the heroin epidemic, because with Western medicine, we tend to give pill after pill after pill, and it has its place. But this is something that is non-diagnostic. It's no medication, and it's done in a community setting with usually you can have as many people as comfortable, and for 30 to 45 minutes, and they just rest. Because what this does, it hopefully helps to reset your system. And the 5 points on the ear are very strategic. So that's all we're doing. You're not acupuncture or anything else. And what it's found is to help with the things that go along with addiction, the not sleeping, I can't rest, or sometimes, this is all trauma responses. And they also use this during 9/11, during the hurricanes and things that you don't have the words yet to talk. So this just gives yourself a time to help heal. This is not supposed to be a standalone treatment. It's supposed to be used in conjunction with people, with a program, whatever it is that you need. The history here in Illinois, prior to 2017, you could use it. But the Illinois Acupuncturist Society, when they got their statute to be recognized in the state of Illinois, it wiped it out that unless you're an acupuncturist or you are a doctor, are the only people that can do this. Even I'm, with my training as a nurse, and this is over 20 years, I can't do that. And that limits to who it is. And especially, we're talking the West Side, and I've done some work rurally. Can you imagine just how even bad it is rural? We're all in this together. We can only be as strong as the weakest person. And it's a lot of those areas. So what we're hoping and what we're working to do, we're working with representatives to get this introduced. We had it introduced the last congressional period. I think it was the 103rd Congress, which was by Representative Wynn, who's in the 13th District. What happened was once he introduced it, it got stuck in Rules Committee and it didn't move. And we finally found out what happened. The Illinois Medical Society stopped it. So we're working on language. We're getting organization. So if this is something you're interested, I have put my information in the chat, also with the 5NP fact sheet. Please reach out to us. We're learning. We need to know who your representative is in the state and the Senate so we can work with them. This is really important when we're talking about Black and Brown communities and Indigenous communities. It is legal in 26 states and international already. Let's work to make Illinois the 27th state.
All right. Thank you, Dr. Diane. That is our last presentation. Does anybody have any member announcements? We have 3 minutes left in our meeting. If you can make your announcements real quick, if you have anything. Okay, we're going to send out a recording. We're going to send out the chat. We're going to send out all the presentations regarding all the stuff that was talked about in today's meeting, because it was a jam-packed meeting, and I know you guys want all the information that was from this meeting. We will meet in person in January 15th on Dr. King's actual birthday at Haas. We're doing our National In-Service Day, our Rep for its Health Equity Challenge. We'll be meeting at Haas from noon. There will be lunch. It'll be a yummy lunch. And then afterwards, we'll have a presentation, and then we'll be building kits. So from noon to 3 on January 15th, at Haas, we will be doing our day of service for the Reverend Dr. Martin Luther King. So please come on out, invite your friends. It's going to be a great afternoon. Does anybody else have any other announcements, questions?
Happy holidays.
Yes.
Right. Happy holidays.
Right. Happy holidays. You guys have a great happy holidays, and we will see you in the new year on January 15th. And I'm going to let you guys go. Bye-bye. Bye-bye. Thank you. Thank you, presenters. Thank you. Bye-bye.
Bye, everyone.
Happy
holidays, everybody.
Happy holidays. Yes. Bye-bye. Thank you.
Hey, Fania, I bumped myself off, so I don't have the full